We go now to Laura Windsor with this report on breast imaging.
Breast imaging in the 21st century has advanced to the point of detecting and diagnosing cancer when it is millimeters in size and easier to cure. We asked Dr. Connie Jones of the Scottsdale Medical Imaging in Scottsdale, Arizona, about the advances being made in detecting breast cancer at its earliest stages.
Breast imaging has made, I think, one of the biggest transitions in the last 20 years of any type of medical service. There has been a tremendous increase in awareness and the technology. We certainly are on the cutting edge of most technology because of the computer system. I think it helps us move at the pace that the real world does. So that helps us when we're imaging, because we're making pictures and we can have different types of pictures so that we can add to our ability to help the patient. The radiologist now has many ways of actually doing needle biopsies, so that with a very minor procedure, with a very small incision, we can get the same diagnosis that you used to have from a surgery. That is really kind of, I think, one of the biggest things in the last 25 years. In addition to that, we are getting much better with our positioning, our technique, with digital technology. That clearly adds benefit to the radiologist when I'm reading a film that I can manipulate and magnify and change the background. That allows me to be a better reader so that I can see things and things aren't hidden. So tremendous advances in the last, even 5 years. Here we also have other things like positron emission mammography, very new technology where we can see the activity of the cancer, not just the structure. So it's not a physical finding, but it's activity. So really, leaps and bounds and things that we can do.
Dr. Jones tells us when a woman should consider screening.
One of the most important things that women need to know is that you should not wait until you feel a lump before you come in for a breast evaluation. The most benefit that we get from mammography is when you're in a screening protocol. That's when we can find things that are very small before you can actually feel them. Sometimes it's several years between the time that we would see it and the time that you would feel it. First, you would meet one of our receptionists. They would register you, talk with you. They would give you paperwork so that you could give your history, things that you're concerned about, things that your physician is concerned about as to the purpose of your visit. Then you would speak with a technologist, someone who is trained in getting a history from someone who is coming in for a breast problem. These technologists work very closely with the physicians so that they know specifically what type of information we need from them. The imaging that is necessary is done, whether that's a mammogram or an ultrasound. Those images are then shown to the physician. We interpret the examination at that time. Then we determine whether we need to come in and do additional imaging for that particular patient. At the end of the assessment, then the patient would know what the findings were. Is this nothing? It's benign? Is this something that needs to be concerning and that we need to do a biopsy? And generally we will speak with the patient as well prior to leaving the facility. So someone who has a diagnostic problem, someone who has a specific breast problem that brought her to the facility will know her results before she goes. Having any breast imaging service is generally anxiety provoking for a woman because most women are very concerned about breast cancer. I think that the benefit that we have here is that we have exceptionally trained staff, very caring people who understand that anxiety. Our facility is beautiful, but I think that our forte is that we really care about our patients. Our physicians, our technologists are highly trained specific to this area, and so I think that the care that you get and the concern that you get is exceptional.
With new advanced imaging, diagnosing breast cancer before it becomes life-threatening can save not just a woman's breast, but her life. For the American Health Journal, I'm Laura Windsor.